Health authorities are still working to identify the virus
States
behind.
States soon start closing schools and announcing stay-at-home orders.
A lot of hospitals are already running out of beds.
The coronavirus presents a public health emergency in the United States.
In my career, the COVID period and post-COVID period has been the most challenging time that I have faced and witnessed my colleagues face in healthcare in over 40 years. Our staff were challenged with the impact that COVID had on their families at home. We had staff members that lost family members and friends. Unfortunately, we lost 4 employees to COVID prior to the vaccine. At the same time, we saw a number of hospitals in our market close. It caused a large influx of patients that may have been cared for in other institutions. We added about 20 beds at Paoli at over $20 million to ensure that we could provide inpatient care for patients that were backing up in the emergency department. We incurred that expense. We thought it was the right thing to do.
During COVID, healthcare really taught us a lot about ourselves and a lot about our team members. There was a major shutdown of all businesses across the country, but healthcare providers such as Mainline Health did not shut down. Thanks to our wonderful nurses, clinicians, physicians, and back office staff, they kept our doors open 24/7 to see and take care of our patients.
Mainline during the pandemic was very challenged with the different waves of COVID. There were several significant waves, 4 waves for Mainline Health, and each one got progressively worse.
We never closed any beds. We managed to staff every bed that we had to ensure that we could meet the needs of the community as the number of cases and the number of people needing health care was increasing.
The team every day really demonstrates their commitment, and I have story after story where the staff have stepped up and done something above and beyond. Because we had so many patients, everybody had to step up and take care of the patients, and they did. But from that, we had to spend over $100 million to provide the adequate amount of staff because we did have some impact of turnover and the Great Resignation.
We've seen burnout, clinician burnout, nurse burnout. It's real. In addition to the wage inflation that we've seen to attract and retain our clinicians, we've also seen pretty material increases in costs of supplies, increased costs of drugs. All of that expense inflation, we haven't been able to keep up with it in terms of revenue growth.
Think about the cost increases that you've incurred in your everyday life. For a health system like us, we have limited ways of covering those cost increases.
We never, ever, my years here, have experienced the level of inflation that we've experienced in the past 3 years. To think that labor costs have increased over 25%, our costs and supplies have increased, our utility costs have increased significantly, and the turnover in our professional staff, our nursing staff, has been significant. Never before have I experienced anything like that.
We still, over the last 3.5 years, have lost money 3 years out of 4. That's despite huge efforts on the part of our staff that have resulted in almost $400 million of cost reductions by doing things more efficiently. The problem is that $400 million of cost reductions did not cover the cost increases that we've experienced over the last 2.5, 3 years. We don't have the ability to raise our rates as the cost of care goes up. We're not necessarily getting any additional reimbursement from commercial payers or government payers. That literally is coming off the bottom line. And that's why it is so important that philanthropy continue to be what I tell people is that 4th leg of our stool. We do a good job at managing our expenses. We do a good job at managing our revenue. We do our best we can on managing our contracts. But that 4th leg of the stool that at Mainline Health is a game changer is philanthropy.
Philanthropy is vitally important to our success. And we know that safety, quality, equity, affordability, that's very important, connected to our mission, vision, and values. But without philanthropy, we could not serve the community, and we likely wouldn't be who we are today.
It means a lot to see people writing even small checks to be supportive and recognize all the efforts that Mainline Health and the team members are providing.
We have raised over $275 million from our community to reinvest in our facilities, invest in new programs, invest in technology that we would not have been able to afford had it not been for our community.
It's just gratifying to know that there are people who are generous enough to donate to a cause that will allow us to have the tools that you need to do your job and to do it well, not just good enough. It chokes you up to see someone come in so handicapped from their symptoms, and then we totally reverse them and they're able to smile. I mean, that is a huge impact on people's lives.
Every one of our campuses has had major capital campaigns and major initiatives that were supported by our donors that quite frankly wouldn't be what they are today if it wasn't for those donors. One of the reasons we're doing this outreach to all of our system donors and friends is to let them know that we're about to kick off an unrestricted campaign.
The unrestricted fund will provide for senior leaders avenues for them to be able to discover what is needed by each department.
The ability to use the dollars where you think they can best serve the community or the organization is really helpful and very powerful.
When there is a need in the hospital that normally does not go for board approval through the Mainline Health Board, we can, as a hospital, approve that need. The monies that go into the unrestricted fund are monitored by the board and the donors. So they have a say in where this money goes. We were able to do so many things here at Paoli through our unrestricted fund, and it ended up being, for me, the most gratifying thing that I did as chair of Paoli Hospital.
Our job is to do everything we can to return the healthcare system and the delivery capabilities that we all got used to prior to the pandemic, to ensure that everybody that needs care can get that same level of care.
Unfortunately, I had a very difficult time with COVID, and I ended up just really having severe long haulers. And it was, I get teary-eyed because it really affected me as a person. And through Unrestricted Giving, they have this program at Bryn Mawr Rehab where I was able to take part of it, and they worked with me diligently for weeks and weeks, and just brought me back my strength, my cognitive ability, everything that I had lost through my terrible bout with COVID. And that's why, to keep these standards, that's why it's so important to give to the unrestricted fund, so we can keep these programs going and helping individuals through their very difficult times.
With the continued support of our donors and the community, I know that we're going to be here for the next 100 years, and I'm really excited about how we're going to do this together. And the Unrestricted Fund is a wonderful way to make sure that we get there successfully, and it's a little easier along the way.
For all of you that are watching this video, I invite you to join in this Unrestricted Fund capital campaign. This endeavor is something that will be with Mainline Health forever and ever. And that's a legacy in itself. And for all of you to be a part of this legacy is very special.